Welcome to Med Madness, your go-to podcast for mastering medical knowledge. Today we'll be diving into an important cardiovascular topic, mitral stenosis. Understanding this condition is crucial for medical students and healthcare professionals as it has significant implications for patient management and outcomes. In today's episode, we'll cover the definition, causes, pathophysiology, symptoms, diagnosis, treatment, and even walk through a real-world case study. Let's get started. Mitral stenosis is a condition characterized by the narrowing of the mitral valve, which impedes blood flow from the left atrium to the left ventricle. This condition is primarily caused by rheumatic heart disease, often resulting from untreated streptococcal throat infections. Other causes include radiation therapy for certain cancers and, though rare, congenital factors. The risk factors for mitral stenosis include a history of rheumatic fever, particularly in individuals from developing countries, and radiation exposure. Women are more commonly affected by this condition. Let's delve into the pathophysiology of mitral stenosis. The narrowed mitral valve increases pressure in the left atrium, leading to its enlargement. This elevated pressure is transmitted backward into the pulmonary veins and capillaries, causing pulmonary congestion and hypertension. Over time, these changes can result in right-sided heart failure. The enlarged left atrium also predisposes patients to atrial fibrillation, significantly increasing the risk of thromboembolic events such as stroke. Next, let's discuss the symptoms and clinical presentation. Patients with mitral stenosis often present with symptoms such as exertional dyspnea, orthopnea, paroxysmal nocturnal dyspnea, and hemoptysis. Pulmonary edema and right-sided heart failure may also occur, leading to symptoms like lower extremity edema. Atrial fibrillation is a common complication, which can manifest as palpitations and an irregular heartbeat. Next, let's discuss diagnosing mitral stenosis. Diagnosing mitral stenosis involves a combination of clinical evaluation and diagnostic tools. A classic finding on physical examination is an opening snap, followed by a mid-diastolic rumble heard at the cardiac apex. Echocardiography is the gold standard for diagnosis, revealing an enlarged left atrium and increased transmitral flow velocity. Additional tests such as electrocardiography, ECG, may show atrial fibrillation or left atrial enlargement. Now let's move on to management and treatment. Management of mitral stenosis includes both medical and surgical interventions. Medically, patients with atrial fibrillation require anticoagulation with warfarin to prevent thromboembolic complications. Beta blockers or calcium channel blockers can help control the heart rate. Diuretics may be used to manage pulmonary congestion. Surgically, options include percutaneous balloon mitral valvotomy, which is less invasive, or mitral valve repair or replacement for more severe cases. Lifestyle modifications such as avoiding strenuous activities, maintaining a healthy weight, and managing hypertension are also crucial in the overall management plan. Let's illustrate this with a brief case study. Consider a young woman from a developing country presenting with progressive exertional dyspnea, nocturnal cough, and hemoptysis. Physical examination reveals an opening snap and mid-diastolic rumble. Echocardiography confirms the diagnosis of mitral stenosis with significant left atrial enlargement. She develops atrial fibrillation and is started on anticoagulation therapy. Given the severity of her stenosis, she undergoes a successful percutaneous balloon mitral valvotomy, leading to symptomatic improvement. To summarize, mitral stenosis is a serious condition with significant hemodynamic consequences. Early diagnosis and appropriate management, including both medical and surgical interventions, are crucial for improving patient outcomes. Remember, understanding the pathophysiology, recognizing the clinical presentation, and knowing the treatment options are key for any medical professional. Thank you for tuning in to Med Madness. Don't forget to engage with our pre- and post-podcast quizzes and use our Anki flashcards for effective study. Stay curious, stay informed, and let's change the medical education system together. See you next time.